As healthcare navigates evolving constraints and patient expectations, organizations are looking at ways to optimize their EHR investments for future success. In this next session, hear from experts at a large hospital and top interoperability firms about how they are seizing opportunities to ease patient and staff burdens. Before we begin, I'd like to give a special thank you to our session sponsor, DocuSign. DocuSign redefines how the world comes together and agrees, making agreements smarter, easier, and more trusted. Today, over 1 million customers and more than a billion users in over 180 countries use DocuSign products and solutions to accelerate the process of doing business and simplify people's lives. Now, I am pleased to hand the floor over to our moderator for this session, Christina Wong, Head of Healthcare and Life Sciences Product Marketing for DocuSign. Christina, take it away.
Hi, everyone. Thank you so much for joining us. As you heard, my name is Christina Wong, and I lead the Healthcare and Life Sciences Product Marketing function at DocuSign. And as your moderator today, I am so thrilled to host this conversation around doing more with your EHR investments. In today's uncertain environment, technology is a must in order to meet your patient expectations, improve the care coordination, and address health equity disparities. This webinar will feature 4 esteemed leaders in healthcare. This industry will showcase how you can take your current investments in your technology stack and have it work better for your patients, staff, and clinicians. So in the next slide, you're going to see that we are breaking this conversation up into 2 parts. First is a fireside chat with the renowned leader and doctor, CEO of Mimit Health, Dr. Romi Chopra, alongside with Nicole Klaus, the director of special, okay, her title is not on that slide. What is your new title, Nicole?
Special Technology Projects.
Should I start over at the beginning of the slide?
That's okay. Yes, if you could start over at the beginning of this slide, and then I will fix that title in post, Nicole.
Thank you.
Okay. So we are breaking up this conversation into 2 parts. First is a fireside chat with the renowned leader and doctor, CEO of Mimit Health, Dr. Romi Chopra, alongside with Nicole Klaus, Special Technology Projects, and she works for Rogers Behavioral Health, which is one of the nation's largest providers of behavioral health services. They're both going to set the stage for us with their real life transformation stories of how they re-envisioned healthcare through digital transformation. Then we're going to turn into this session into an interoperability showcase. It's really your opportunity to get a practical understanding of the latest EHR innovations in interoperability so that you can understand that what Nicole and Dr. Chopra are talking about is not just in theory, but it's based in reality and is available today for you. So before I dive in, let me just give a brief introduction to myself. I've been at DocuSign for 4 years, and I've worked with all of these partners here that you have today in helping bring new products to market, including some of our top innovations that we've had at DocuSign related to healthcare-specific solutions. I've been in the industry for almost 20 years, and I've worked across the private, the public, and the nonprofit sectors, including working in the California State Legislature, Johnson & Johnson, and other various startups. Now that I've introduced myself, let me give you a brief introduction to DocuSign as to why we're hosting this session. I'm sure many of you know us as an e-signature company and are quite unaware that our product suite spans beyond e-signature. We've actually this year launched new capabilities to seamlessly connect to any FHIR-enabled EHR, including Epic and Cerner. And this is why we're here today, because your forms and that patient journey can be automated and seamless, whether it's the preparation, the signing, the acting, or the managing of these forms, we've actually been able to help a significant number of healthcare providers in the industry, up to over 1,400 providers. We're in the top 19 of the 20 top Fortune 500 healthcare companies. And overall, DocuSign is in over 75% of Fortune 500 customers. So we are a trusted solution that we're hoping you see that it really is about investing beyond your EHR to be able to rethink how we do business in healthcare. So as you can see in the next slide, healthcare has been transforming. There's a lot of digital technologies out there that you have to think about in order to meet this moment. And yet the EHR is where most of your investment has been, which is wonderful, but it isn't the end all be all. The key is knowing how to leverage your EHR technology along with all of the other technologies out there in order to stay ahead of some of these key trends that you see here. As we all are aware, telehealth had a huge boom. Wearables is part of the way that we monitor patients' health data. The big talk today is all about generative AI. And what's really focused in on this conversation today is how the 21st Century Cures Act is reshaping how we think about interoperability and how we can stay ahead of some of these key trends and changes in order for you to be able to meet the needs of this moment. So now I'm really pleased to turn it over to our healthcare leaders, Dr. Chopra and Nicole Klaus, to help us understand how they're addressing these type of changes and uncertainties. So let's transition to the fireside chat. So let me start with Dr. Chopra. Hi, Dr. Chopra, how are you?
Very well, thanks. Thanks for having me here.
Thank you. Thank you for joining us. So, Dr. Chopra, you've had an amazing career in healthcare for over 30 years. You've transversed this industry. You've had a fellowship at the Harvard Medical School. You've led academic research, programs, fellowships, including residence. You've taught as an associate professor of radiology at the Rush University in Chicago. And you were awarded the Distinguished Physician Award and a U.S. Congressional Medal for Excellence in 2018, as well as being the chairman of the Department of Radiology at a large academic institution. Yet with all of this, long career in traditional healthcare, my understanding is you became dissatisfied with working in it and you decided to found Mimit Health in 2003. So can you help the audience understand what caused you to want to embark on this digital transformation and start Mimit Health?
Yes, I'm in the business of taking care of people. And as much as I traversed all these large organizations, etc., first challenge I found was, it was not patient centricity. It was all about the institutions, and everything was designed for the benefit of the institution or whatever the organization was versus all about the patient. And the other thing that I also saw was, so there was a lot of frustration in my mind about this. So I stepped out and I said, there's got to be a better way to do this. Once you work out of the domain of healthcare, you find out the rest of the world is fully digitally transformed. Everybody's living off their mobile devices, and everything is kind of at the speed of life except medicine. You need to pick up a med, it's difficult. You want to get an appointment, it's difficult. So I started kind of solving for one problem at a time, so to speak. And I knew the answer had to be digital transformation and technology. Technology is here to stay. Technology by itself does not solve problems. So we started looking at how can you effect that change effectively so that patients could lead their best lives. And I could go on for a while, but that's really what got me going.
Thank you, Dr. Chopra. Now, Nicole, I am so pleased to have you. How are you today?
Very well, thank you. And thank you for having me.
Yes, we're so happy to have you. So, you have been at Rogers Behavioral Health for quite a long time, and you've had a long career in IT. Can you help us understand your journey at Rogers Behavioral Health and what caused you to think about the EHR differently as well?
Yes, I'd love to. I started out my career at Rogers a long time ago as CNA, or what we call mental health technician, worked through various different clinical roles as a practicing nurse, nursing leadership and education, and paper charted and rewrote medication administration records by hand, and searched for charts so that we could document. And throughout that journey, we were really starting to behavioral health has been a little bit behind medical hospitals when it comes to a digital transformation. They also have an added complexity of having different regulations or laws specifically regarding patient confidentiality. And so throughout that journey, just learning that there are so many different ways that you can do things and how you can digitize. And so I had the experience to do a smaller implementation and just learn as I went. And so I joined our technology team about 12 years ago, and have seen us through several implementations and upgrades, and through different types of transformation, and just really learned through my clinical experience how we could integrate and bring together the digital record to really help to take care of patients. So I really appreciated Dr. Chopra's comments on keeping the patient at the center, because throughout that journey and throughout paper records, and as we implement different pieces of a system, we don't have that patient at the center and tend to have different ways of taking care of them, or separate systems. And so just bringing those together has always been a passion and desire of mine.
Absolutely. I mean, DocuSign, we believe that the patient has to be at the center. One of our customers, Hospice Savannah, has this deep belief that it's in these pregnant pauses that you have with patients that are around 3 to 4 minutes is when you can build rapport and have a relational experience with them, so that you can actually understand their needs more. And it's really, their belief is when the truth is revealed. And I really think that technology, at least Hospice Savannah believes this, is really integral in being able to allow patients to have those pregnant pauses. So let me turn it over to you now, Dr. Chopra. When you went on your journey into trying to look at healthcare differently, what limitations did you see, and why do you think many providers today need to address these limitations, particularly around the EHR?
Yeah, the EHR, if you look at it, is just a piece of software, and it was designed primarily for billing. And I go back, I started in India, and I've done procedures and surgeries around the world. Some parts of the world still have paper, including countries like Australia. And I've done a ton of paper charting, just as Nicole mentioned, including research and you name it, all the way. And I realized that healthcare in the end is actually an information game. If you don't have the right information to make the right decisions at the right time, you got a problem. And it was always, doing the surgery was the easiest part. But what surgery do you do? On whom do you do it? Why are you doing it, etc.? So that was the biggest frustration. We started off by, I don't know whom to reach. Who do I ask? I have a 85-year-old demented patient. Where's the power of attorney? How do we reach them? It started with simple things like that. And I actually distinctly remember two things. One was that I just wanted to add a phone record, field in the EHR and a URL. And it took them 5 years to give me that. Just a simple field. And that was one. And the second thing was, when you look at insurance companies, you got to do pre-authorization, you got to this. It's all an information game. You take the data, it becomes information. You got to put it all together, and going back and forth and back and forth. And then I realized, hold on, I did some work in just as a trial, if you would, or a side gig in a insurance company. And I saw the technology they were using. It's not there for patient care. So I switched around and said, aha, we're going to do this. And I started solving one at a time. I switched through EMRs. Now we have a SaaS-based EMR, SaaS-based patient engagement, created a platform integrated, all kinds of things where it's patient-centered, evidence-based. You do it better, faster, cheaper. That's what the Amazons of the world do. And I call it medicine at the speed of life. But we're centered on the patient, we're connected with them, and we collaborate for their success. What used to take us weeks and months, we do in hours or less. And that's the power of helping people lead their best lives. And it's not just about disease management. It's really about managing their health, their wellness, all the way around it. And information is right in the center of that. So that's got me going on this process this week, on the journey.
So before I switch to Nicole, I have to ask you kind of the elephant in the room here, is Mimit Health, you started the company, you have full control, and it's not as large as some of these large enterprise companies. And I think the conversation around generative AI causes people to really understand that it is a data game, as you mentioned. But describe how these people on this webinar, especially larger ones, can identify with your story. What should they be thinking about and saying, well, if Mimit Health can do it, I can do it too?
See, technology is here to stay. In the end, it's all about connecting with people. Why does Facebook have over a few billion, consumers? It's all about the desire to connect with other human beings. We're social creatures. And as we were walking through this journey, we deliberately stayed narrow and deep. It was I've tried this, you just expand. But again, it's not effective. So in the end, we talk about the quintuple aim. You provide good care, you provide it at a good price, cost effective, less provider burnout, patient experience is great, and there's equity at the end of it. And that's all. You don't want provider burnout. So we've been able to do all of those things. In fact, after this transformation, systems were in place and we started working our way in the new paradigm. One of the commonest things I get from people that we've recruited is, darn, I don't think I can work anywhere else because this is just too good. In terms of, they don't chart after five. And this is just not software. These are the processes and the people in there so that you can run this really effectively and well. And in the end, what does the patient want? For example, and I learned this from the business world, if you have mice at home, you're not looking for the fanciest mouse trap. You want to get rid of mice. If you're a human being and you're not well, you want to feel well. You don't care how fancy somebody else's instruments are, how beautiful the building is, et cetera, how good the technology is. People want solutions. And I think that's the reason why. We have patients. I've had patients for 20 plus years. They can text us, call us, email us, live chat, you name it. We've been able to get that thing through. So.
Thank you. So, Nicole, Rogers Behavioral Health is very different here, which is why I really appreciate your perspective. It's very large. There's silos between your different stakeholders in your organizations. Each have different needs. Can you talk to us and describe how your technology, and particularly the technology you've implemented beyond the EHR, can break down these silos and how you're thinking about data as well?
That is a really great opportunity to talk about why we decided to go in the direction. We identified a gap in that we have silos where registration has specific needs. And has a specific area within the software that they use. Clinical will use a different area, but in the end, we're all taking care of the patient. And so if we have different processes, we have different systems that are getting the same information, but not in the same way. We are creating burden and silos by asking our staff in different areas to do additional work to capture the information so that it talks between the two areas. And so really what we need to do is think about the entire patient journey and try to find systems and softwares that will accomplish the same purpose, as opposed to having one group sign consents in one particular way and another group sign documents in a different way, just because of their different processes and the places that they document within the record.
Yes, excellent. So, Nicole, you've talked a little bit about some of the systems you have in place and your vision of these different systems. Talk to us a little bit about the technology that you're thinking about and how you decided to prioritize on these particular technologies.
Patient engagement is very important to successful outcomes. And in order for our patients to be engaged, we have documents that we have them review and work with. So, for example, when a patient is discharging, we'll have a safety plan or a recovery plan that helps set them up for success. We also have consents that explain treatment. We have different documents that they can go through that explain treatment. And what we were finding is, depending on the document type or who gathered the signature, we had a different way of doing that. And in typical software industries, what you'll find is you'll get a solution. However, it might be a solution that requires additional steps or additional burden to be able to capture the goal that you're trying to do. Or, depending on where you're working in registration, I might have to obtain my consent this way. However, if I'm working in a clinical area, I might have to capture my patient signature this way. And when you're working in a small clinic or you're trying to respond to patient needs very quickly, or you're trying to talk with a parent whose child might be receiving treatment in a facility not at home, you want to be able to have the staff engage that patient and get them the information they need in one way. You want to be able to not have discrepancies in the ways that you're accomplishing your tasks by having the system work for you, as opposed to have different paths that you need to take. And so we really looked at what our options were. How can we send out documents securely, following behavioral health regulations, and get them to family members, patients who might be participating in telemedicine, patients who are not within our grounds? How can we get them the documents in one way and then get them back within the record without having the staff that are receiving that document have to go through multiple different steps to make sure it gets in the record? And so we really looked into DocuSign and No2's work on integrating within the EHR so that we could accomplish that with one process.
Excellent. Dr. Chopra, you looked to a very elaborate technology stack when you wanted to expand beyond the EHR. Talk to us a little bit about what's in your technology stack and what requirements did you look for to be necessary to succeed?
And the very first thing was I before I went out on this journey, I approached a lot of companies and they wanted tons of money. There were all kinds of complex things. Some we even paid for and they never delivered because the promise was greater than the actual execution. So the first thing was click no code. Second was had to be a platform. We weren't just installing software. Third, they had to be one patient centered and more process oriented, so if you would, and then the ability to talk to other platforms and systems, if you would. So we choose Salesforce, we've got DocuSign, but they're integrated. We've got Vonage, it's integrated. We use Box for document management, integrated. It has all the security features that we want on top of it. But then we had a kind of an older generation EMR. We've gone through 3 or 4 of them, and I had an EMR before even primary care docs had it. But we were trying to solve for this problem. Now, finally, we have a SaaS-based EMR. We've actually invested in interoperability software like MuleSoft, where we're actually creating and it's all designed not just to do a fancy project with IT and technology, but to actually solve a problem. So our PACS is integrated with our EMR. We have external other vendors we use for other software related, like we do a test called Biomedics PadNet that integrates with our EMR. We integrated our billing. If you are a patient, we all live on our phones all day long. So guess what? You can text us, page us, but we can do the same. So we've got Marketing Cloud, we got SMS short codes. We can put you on journeys. And the best way to take care of people is to educate them. We've also built up a e-commerce platform to help patients. It's something we partnered with one of our sister companies, but is to find a way when you give a patient, hey, you need these compression garments, or you need certain solutions that you need to go get. They go wandering looking for a facility versus they do it all on the platform. We don't have one piece of paper, and all of this is working integrated with each other. So the point was we need a solution. We don't need another software.
Mhm.
I remember years ago, somebody I knew said he bought Flight Simulator and he thought he was going to be a world-renowned pilot. You don't become a pilot just with the software. Similarly, just by Microsoft Word, you don't become J.K. Rowling and a world-renowned author. So, just the same way, just having software doesn't help. The process and guiding people through that workflow. I mean, if you think about it, Amazon probably drops a box to almost everybody's house once a day. And you see the process they follow and how they have you engage. You have a text message come in, your package is on the way. When it comes, you get a picture, you get a text message. We practice medicine that way. I just did 3 surgeries today. The minute they were done, the key stakeholders in their world, we call it their household, they all got a text message saying, hey, so-and-so's been done, so-and-so's well, and you can always reach us as this number, et cetera, et cetera. So that was the idea, is to have solution-based, click no code, didn't want to write tons of code here and there. People get lost in that fancy stuff. I got the sexiest software out there. That's not what we needed. That's why, for example, landed up with Salesforce. Easy. As a doc, I know more about APIs than anybody should, I guess. But, we had to learn that. HL75, earlier it was a nightmare getting a simple piece of information to come from point A to point B. But now every day we solve for one. Revenue cycle billing is one of the biggest nightmares for patients. And so we started solving for those issues as well. And now, patient can have their credit card on file. It's just all these solutions that in real life you use every day. And so that's how we kind of landed up with this.
I love that. I love that everything is connected. And I think what I find really fascinating is DocuSign did some research around this interoperability piece and how we could help connect the care continuum, and found that 70% of the industry still uses the fax machine. And this is because the fax machine has been the way that we break those silos. It hasn't, we haven't thought about healthcare in the way I think Dr. Chopra or you, Nicole, have sort of thought about just the bigger journey and how we can connect everything for the patient. And so we have these disconnected systems where the best way to communicate is via fax. And from DocuSign's perspective, while fax has its place, a lot of this digitization that can happen with documents is actually at the heart of a lot of this slowness and manual processes, finding documents, connecting them. I would really love to hear from you, Nicole, around this piece around, the entire industry is kind of maybe still using fax, or kind of an older way of thinking about things. How have you approached this idea of not letting that keep you entrenched in that sort of old way and that old silos, and using technology to break free of that?
That is a really good question. We tend to struggle with that, particularly with behavioral health treatment and substance use treatment. There are really strict laws that go beyond confidentiality laws when it comes to what we can and cannot disclose without patient consent. And so we really have worked with how can we share records, particularly with medical facilities, non-behavioral health facilities. How can we get those records, the treatment records, to the next level of care seamlessly and electronically? And so we've really looked at solutions on how we can educate patients on releases of information, what records they would choose to have released. How can we connect to some of the, I'm trying to think of the word, interoperability channels where we can share records with other facilities. How can we educate patients and be able to keep those records that they want to be held confidential while being able to participate in health information exchanges. And so we've really been looking at how we can do that within the confines of confidentiality with behavioral health records. I think a big part of that has been looking at common data elements or common data sets like medications, allergies, diagnoses, and really looking at how our documents look, and the information that pulls into value added information and getting those to that next level of care. I'm sorry if I'm not answering your question correctly, and you can edit that one out.
No, it sounds wonderful. I mean, what I love and why I'm really glad that you're here to join us is because behavioral health is such a sensitive subject. I mean, that's why we have the regulations of the making sure that that medical history doesn't impact future employment. I mean, when you're talking about substance use or other things like that, especially in today's post-COVID world, and these needs are only increasing. How do we deal with confidentiality, but also the need to make sure that the patients are at the center, their data doesn't get lost across these silos so that they could actually have good outcomes? Like, imagine if Dr. Chopra is treating one patient and then goes to your facility. Are we faxing that information? Like, how can we envision sort of a new paradigm? Dr. Chopra, would you like to weigh in about this idea about sensitivity and confidentiality, but yet the need for data portability?
Yes, of course. I mean, the Medicare, who's obviously the largest player in this, that's why you have FHIR coming out, standards, everything. It used to be HL7. Actually, already now we are part of SureScripts and Care Equality and exchanges. We are exchanging a lot of information electronically. So when patients come in, we obviously get consent from them. And then if they have been to other places, because we are part of this network, Care Equality and the soft EHR we have as part of SureScripts, it tells us where this patient has been. It tells us all his meds. It's all CDA and now CCDA. So that's coming in with FHIR standards. It is standardized. Problem lists are the same everywhere. Med lists, medical reconciliation. Those little things. And our EHR now allows us that if there's a patient that has to stay confidential, you click a checkbox and it's confidential. And you can now, and this is standard across every other industry. Look at the finance industry. You can take your card or be anywhere in the world, log in and get all your financial transaction history forever. Try doing that with your health information. It's not possible, but it's getting better, I tell you. I mean, I am deep into this, way beyond my eyeballs. And every day we solve for a new problem. So in the last few months, we've solved it where I've taken care of a patient and he had forgotten to tell me that he has a certain primary care doctor he had seen at another facility. So in our EHR, a document popped up. It says, hey, here's a continuity of care document and the location summary. We noticed, here's a doc that he has seen. It's his primary care or family, some other doc he had seen. In our interoperability platform, typed the doctor's name and popped up. He's got direct messaging. And I selected the clinical summary, sent it to him, and vice versa. So now we are working with each one of our referring providers and other providers that we work with, and we're doing that. But the part of the challenge is, you remember how when big data was a big word and everybody was saying big data, big data, big data? Nobody hears of big data anymore. The data is still there. It's still big. But now it's AI, generative AI. You need an LLM, a large language module. That's the buzzword today. There's a lot of marketing effort around it. Technology companies are but technology is here to stay, but you want the solution. And the solution is our patients, all the human beings want to feel well. They want to live their best lives and work our way from there. And these technologies are meant to, along with the processes, solve those problems.
Mm-hmm.
Hope I made
Nicole,
sense.
Nicole, just going from what Dr. Chopra was saying around, it's about the patient, it's about making sure that they get the care that they need. What I find really interesting is how you've been able to tie data and outcomes together through actually your agreements or the paperwork, yet maintaining confidentiality. Can you talk a little bit about those success metrics that you look at in how your technology and your digital transformation has helped you improve patient adherence and outcomes?
Absolutely. I'm taking a deep breath. So, when it comes to outcomes, what we have found is that patients are more successful when they are engaged within their treatment and when they also have support systems that are engaged within their treatment. And so we really have looked at data and how we can engage patients and their families within treatment. We've also looked at things like suicide risk, things like relapse prevention. How can we give patients the tools that they need when they leave our care to be successful once they leave our environment? And so, really collecting that data through those different elements that we document has been very important because that helps us to be able to see how those go through. Christine, and I apologize. Can you please repeat that question?
How your digital transformation improved patient adherence.
Yep, you bet. Okay, so we have had the opportunity to really reinvent how we plan for discharges. And so every patient, when they leave our care, will receive a safety plan. Patients who are here for substance use will receive a recovery maintenance plan. And so we have the opportunity to really partner with our patients and their support systems to be able to identify those pieces that are very helpful to them. And what we've had the opportunity to do is engage the patient within the record instead of handing them a paper form saying, how do you plan on really planning for your discharge? We engage them throughout that network, and we'll have the opportunity very soon to be able to get that plan to that identified support system, so that support system will be able to help them when they discharge on what they said would help with that plan.
I love that. I love that you're able to, the digitization helps you be able to maintain and see how they are on track. Dr. Chopra, let's kind of pivot a little bit away from the patient and talk about budget. So budgets are limited. We're here to talk about how do you leverage your EHR investments, because that's where a significant portion of providers' budgets are. So talk to us a little bit about how you do more with less, and in particular, how you work with that change management.
Yeah, first is people are the most important. People run through these processes, and you need the right systems for that. So that was number one in terms of managing change. There's a difference between expenditure or cost and value. So when we started looking at any system, any software, we're still adding to our stack, believe it or not, because we're now going into the analytics part where we're looking at larger data warehouses and doing some data in the cloud to start computing and getting literally insights on the fly. But when you look at those expensive systems, you look at what would be the return on investment. And when I took some pretty heavy hitting software, and systems, but when we applied it, the very first year, Nucleus Research, an external company, and this is not our calculations, but theirs, that the first year itself, we had a 490% return on investment on that stuff. So if you are focused on the patient, getting the solutions, and you do it better, faster, cheaper, which is logistics, you then find out that all of this pays for itself and more. The problem is when you just buy a piece of software, implement it, and we've lived through that too, where you didn't pay attention to the processes, didn't have the right people, And now you're trying to come up with outcomes. It doesn't work. It's like buy me a jet and I don't know how to fly it. I have no hangar to maintain it, and I have no idea what rocket fuel's like. I'm going to crash that plane. I don't spend billions on it. So with that, we realized we would take a problem, find the key frustrations, look at the cost of that, then invest in it, and over time get the return on that investment. And that's how we manage budgets. We're just saying, I got to go spend money on this.
Well, I mean, that's kind of leads us into this idea, and you've mentioned it briefly about the quintuple aim. You're talking about the cost piece, and I have a stat here from 2023 McKinsey report that said 45% of inpatient nurses are reported that they're likely to leave their role over the next 6 months or intend to leave. So we've talked about the cost ROI. Just talk a little bit about the job, the satisfaction, and improving that piece within your staff that's part of the quintuple aim.
So we made sure along that part that, for example, I have 5 nurse practitioners that I've hired within the last 16 months. And we made sure they were on the digital platform. So we've invested in scribes, in different technologies and solutions that, for example, when I come up with a care plan, I see a patient, I have an assessment, I come up with a care plan. When I kind of say, this is the plan, all that goes into a platform, tasks are assigned to people, all the notes are done. They don't have to go home and document. You see, you don't take somebody who's worth several $100 an hour and make them do the work of somebody who could do it at $10 or $20 an hour, or even $30 an hour. So there's a lot of efficiencies that can be built into this. And as we've done that, we found that as our employees and team members have less burnout, they come in with more energy. You have positive energy to the patients. You're solving problems on a daily basis. And we've focused very hard on making sure that that stays at the center of our existence. So one of the biggest things we've had is less burnout. And we are doing, over the last 18 months, I cut 28% in costs. And actually, our revenues and profitability and outcomes went up 2.5 times.
Wow.
It's built in the efficiency. So, I think it was, if you watch MASH, General Bradley said, amateur stock strategy, professional stock logistics. This is all logistics. And
Yes.
if you look at any service that you get, they'll get a notification in your app, whether it's delivery, whether it's UPS, FedEx, you name it. It's all logistics and it's all information. They drop a packet, they click a button. You want to talk to somebody, you click a button. And that interoperability exists. It's all around us, whether it's Uber and Google and Maps. It's all has to just percolate into healthcare. We're just at the bleeding edge of this, making this happen every day.
Yeah. So Nicole, switching to you about the quintuple aim, can you talk to us a little bit about how you're dealing with some of the job satisfaction of your nurses or your providers? And more, I think, just as important, you do serve a lot of underserved populations, especially those in rural communities. That's a big topic around behavioral health that the onslaught of telehealth actually helped in some of the relaxation of some of the substance abuse sort of prescription laws. So talk to us about how you're using technology and EHR to help the underserved populations and address the nursing burnout.
You bet. And so in addressing burnout, it's not only nursing, it's the entire treatment team. So therapists, anybody, direct care providers, anybody who works within the patient. And I think what happens over time, especially as you implement different systems, is that you layer on top of your system different ways of doing things. And so what we've really done within the last couple of years is look at workflows within systems. So instead of saying at this point, we need to ask the patient about their treatment history, And then once they're admitted, we ask them again about their treatment history. What can we do throughout the course of care? First of all, to capture that treatment history using interoperability and retrievals through health information exchanges about their previous days, and expound on that throughout their care. And so it's really looking at that, the information that we're collecting it, and collecting it at the right place in the right time. The
Mhm.
other thing that we're doing, and this is something that I've been very passionate about, is as we're developing or solving problems, we are getting that voice of the customer. And so we sit down and talk with the therapists that need to document within the system, the patient on what their experience on going through the admission process is like, and really collect that information to be able to have that voice when we're making changes has been crucial. We also have had the opportunity to have them participate in the changes as we make them, so that they're engaged in how those systems are working for their workflows. To address your question in regards to telehealth, I I know that we've really seen a increase in the use of telehealth with particular regard to COVID. Also, the services for behavioral health, particularly specialized behavioral health, accessibility is an issue, and so having the ability to provide telemedicine is crucial. So, having a therapist, direct care providers that are able to deliver that care, leveraging technology to reach clients or to reach patients and their families outside of traditional brick and mortar service areas has been very important. And so, we've had the ability to leverage technology to be able to reach more patients.
Thank you. So we are basically out of time. So, really quick, Nicole, can you give a concluding 30-second, uh, basically advice to the people here online about some best practices for their digital transformation as they're looking beyond the EHR?
I think one thing that I 100% agree with Dr. Chopra on, and one thing that has been very important, is keeping the patient at the center of the record. Whenever we're coming up with solutions, keeping them and their experience at the center, as well as the caregiver's experience at the center when integrating solutions within the record.
Thank you. And Dr. Chopra, can you give a 30-second conclusion to the audience around how they can do some best practices beyond the EHR?
Absolutely. I think first to remember is technology is here to stay, but it's not technology for the sake of technology. It has to solve problems. And as humans, we can't care for ourselves. You need prenatal care, you need postmortem care. We're not born by ourselves, and we can't, bury ourselves. So we need to be part of care teams that are patient centered, and you will need information to help you go through that journey, and that's where interoperability also comes in.
Wonderful. Thank you so much both for all of your insights. This has been really insightful. Now we're going to transition to the second part of this webinar, which is our interoperability showcase. Before I launch into introducing the speakers, I wanted to take a moment to first provide a framework of how DocuSign thinks about driving success with EHR investments. So the next slide shows our vision of how interoperability can connect these three systems. From DocuSign's perspective, how we can think about this interoperability showcase is that it's the glue that connects the system of agreement, the system of record, and a system of engagement. So the system of agreement you could think of as DocuSign. It is a digital platform that helps you digitize all of the forms and agreements. The system of record is the EHR, and the system of engagement is a lot of the platforms that allow for two-way communication or ways to engage the patient. So today in this interoperability showcase, it's going to have vendors or partners of ours that connect these three systems so that you can do more with your EHR and expand that ability to be able to improve the patient experience and the workflows within that care continuum. So let me introduce now our featured speakers. You will see two leading interoperability firms showcasing their solutions. The first firm is Infor Cloverleaf, and the second firm is Know2. York Schwartz will walk us through the first interoperability showcase with Infor Cloverleaf. Now, a brief introduction of York before he dives in is that he is the Senior Director of Strategy and Solutions for Healthcare Interoperability and has been working in healthcare since the mid-1990s. He's built some of the first PAC systems and the first regional health exchanges. At Infor Cloverleaf, he bridges the gap between the old world of HL7 V2 and the new world of HL7 Fire. Our second showcase features Know2, and Travis White will be talking about the latest interoperability solutions as the SVP of Market Strategy and Adoption. He brings over 2 decades of expertise in enterprise and healthcare IT, driving strategic initiatives to improve healthcare outcomes. So let's kick off this interoperability showcase with Infor Cloverleaf. York, take it away. Okay, thanks. Thank you so much, Travis, for that wonderful section, and to York as well. Just to conclude here, I really wanted to take a moment to really connect everything that was talked about today with Dr. Chopra, Nicole Klaus, York Schwartz, and Travis White. What they all stressed is that human connection is the number one piece that needs to remain at the center of any solution. Even when we're talking about something as technical as interoperability, it really is about the patient and being able to put that human connectedness at the center in order to achieve better outcomes. And that it's when you connect these 3 systems of agreement, the system of agreement, the system of engagement, and the system of record, is when all of it together is really where you're able to create a true seamless care continuum to be able to improve the patient experience and to be able to serve those that are underserved better. For many of you, I know it's quite difficult to take a leap forward in trying to build out this digital strategy or embark on a digital transformation. But it's really important as we're striving to address this quintuple aim. And it's really through technology that is the foundation for this change. So I really hope today that all of the speakers here gave you a foundation of some best practices and how to think about these solutions. And then you got to see the actual solutions in action of what is possible so that you can embark and take that leap into this journey to expand beyond your EHR. Thank you so much, and I hope you have a wonderful day.
This concludes the time we have for this session. Thank you to our speakers for your extremely valuable insights, and thank you again to DocuSign for sponsoring this session. For more information on what was shared during the discussion, please visit www.docusign.com. Enjoy the rest of the virtual briefing.